You've probably heard that iron and vitamin B12 are essential for health, right? They're in supplements, capsules, and even in energy drinks sold as miracle solutions for fatigue, weakness, and even hair loss. But what no one tells you is that taking these nutrients the wrong way can do more harm than good. There's a critical detail that can turn the whole game around, and that's what we're going to reveal here. Believe it, knowing this before putting another pill in your mouth can protect your long-term health. And the best part? Those who watch until the end will understand how to make safer and more conscious decisions when it comes to supplementation. Many people think they're doing the right thing by supplementing on their own. After all, if it's sold at the pharmacy without a prescription, it must be safe, right? Wrong. The indiscriminate use of iron and B12 can mask serious problems, trigger dangerous side effects, and even interfere with medical treatments. And even those already diagnosed with a deficiency need to pay attention to the details. In this video, we'll show hidden signs, common mistakes, and what the latest science says about these two popular supplements. If you care about your health, or someone close to you, you'll want to see this to the end. If this information can open your eyes, imagine the impact it could have on the lives of other people who rely on these supplements daily. That's why, if you believe in the importance of sharing useful knowledge, go ahead and like this video, subscribe to the channel, and send it to someone who needs to hear this truth. This helps the channel grow and reach even more people with serious and well-founded content. And while you're at it, comment below. Have you ever taken iron or vitamin B12 on your own? What led you to do it? Let's share our experiences in the comments. And pay attention, not everything is as obvious as it seems. The next point will show why more and more people are becoming dependent on these supplements, even without knowing whether they really need them. And the reason may be closer than you think. In recent years, pharmacies and health food stores have become true capsule buffets. Iron and vitamin B12 supplements dominate the shelves, often side by side with promises of energy, vitality, and boosted immunity. It's almost impossible to walk through those aisles without wondering if you should be taking something too. This phenomenon gained strength especially after the pandemic, when the fear of low immunity became a trigger for unrestrained consumption. The problem is that behind this boom lies a flood of misinformation. Influencers, viral videos, and even well-meaning neighbors began giving nutritional advice as if they were specialists. Take iron, it helps with fatigue. B12 cures your lack of focus. These phrases spread like modern mantras, without considering individual factors, lab tests, or clinical context. That's where the danger begins. What works for one can be harmful for another. But the marketing behind supplements is so powerful that many people don't even question it. After all, if it's everywhere, it must be good, right? A recent survey by the Brazilian Association of the Food Industry for Special Purposes found that supplement consumption grew 80% in the last 5 years. Among the most sought after, iron and vitamin B12. This reflects a genuine pursuit of better health, but also a culture of self-treatment based more on assumptions than diagnoses. People buy based on vague symptoms like tiredness, weak nails, or lack of energy, and often ignore the real root of the problem. It's like trying to fix a crack in the wall by painting over it. The problem is still there, just now camouflaged. When the body receives iron or B12 unnecessarily, it can react in unexpected ways. Excess iron overloads the liver, and excess B12 can hide serious hematological diseases. But who's paying attention to that when the focus is only on feeling better fast? This rush for immediate results ends up being a shot in the dark. And even when the body gives signs that something is wrong, they're not always clear. Often, the symptoms that lead someone to supplement are hiding other causes, and that's exactly what we're going to talk about next. You'll be surprised to discover how the body speaks, and how often we interpret everything wrong. Before any supplement, the body needs to be heard, and that starts with lab tests, not guesses. Iron and vitamin B12 are indeed essential. Iron transports oxygen in the blood, while B12 acts on the nervous system and the production of cells. But at the wrong levels, both deficiency and excess bring serious consequences. Balance is what defines whether they'll be allies or villains. That's why what your body really needs is not immediate capsules, but understanding. Without that, even good intentions can have bad effects. Medicine shows that each body has a unique need, influenced by age, diet, genetics, and even medication use. A pregnant woman, for example, may truly need more iron, while an elderly person may have difficulty absorbing B12 from food. A healthy adult, with a balanced diet, may not need either supplement. But how do you know? The answer will never come from an Instagram video or a guess based on what everyone is taking. The right tests, like ferritin, complete blood count, and B12 dosage, are the only reliable way to know what's happening internally. And even with the tests, interpretation must be done by a professional. That's because seemingly normal levels can hide problems or dangerous fluctuations. Supplementing just in case may seem harmless, but often interferes with the doctor's ability to identify the real cause of a symptom. It's like throwing sand in the eyes of someone trying to help. Besides that, the body is very efficient at showing when something is off, but it's necessary to know how to interpret the signs. Fatigue isn't always iron deficiency. Not all dizziness is lack of B12. There are dozens of other possible causes, like dehydration, stress, poor sleep quality, or hormonal issues. Supplementing without investigating can silence the body's natural alarm, delay diagnoses, and worsen silent conditions. And the most curious part? Many of these deficiencies that people try to fix on their own are, in fact, misinterpreted symptoms. Next, we'll explore these signs and understand why it's so easy to fall into traps when the body speaks. Imagine waking up constantly tired, unfocused, and with that feeling that your body is heavy. It's natural to think, must be iron or B12 deficiency. And that's when the cycle begins. The person buys the supplement, starts taking it, feels a slight improvement, or feels nothing, and continues on their own. The problem is that these symptoms are so generic that they can have dozens of different causes. And by fixating on the idea that it's iron or B12 deficiency, the real root may go unnoticed. A common mistake, but with consequences. Fatigue, for example, could be a sign of chronic stress, insomnia, thyroid disorders, anxiety, or even depression. Lack of concentration could be related to too much screen time, poor diet, sedentary lifestyle, or simply mental overload. But the urge to find a quick fix leads many to resort to supplements. That's where the risk lies. By suppressing the symptom with iron or B12 unnecessarily, the body keeps calling for help, now muffled by a false sense of improvement. Another common symptom is hair loss. People who see hair on the brush rush to buy multivitamins with iron and B12, not realizing that the cause may be hormonal, genetic, or even emotional. The same goes for weak nails, mild dizziness, or lack of appetite. These signs are like dashboard warning lights. It's not enough to turn off the light, you need to open the hood and see what's going on. And supplementing without criteria is like covering the light with electrical tape. Stories like these are more common than you think. Some people spend years treating a supposed nutritional problem, when, in fact, they were dealing with a completely different condition. And in some cases, the prolonged use of iron and B12 without need even generated new symptoms, which further confused the diagnosis. It's a cycle of trial and error that starts with good intentions but can end in frustration or even real harm. That's why we need to look beyond symptoms and understand what's behind them. In the next point, you'll hear real reports from people who took supplements believing they were doing the right thing and ended up facing unexpected consequences. Susan, 42 years old, started taking iron on her own after feeling dizzy and weak in her legs. She thought it was anemia, as she had heard about before. She bought a supplement at the pharmacy and kept taking it for months, without any tests. At first, she felt slight improvement, but soon came headaches, abdominal bloating, and liver discomfort. When she saw a doctor, she found out she never had an iron deficiency and that the excess was poisoning her body. What seemed like a solution turned into an even bigger problem. Another case is Jason, 35 years old, who started taking vitamin B12 to gain focus and energy at work. Influenced by videos on social media, he believed the supplement was harmless. After a few weeks, he began to experience palpitations and sleep disturbances. Only after a clinical evaluation did he discover that his B12 levels were extremely high, which was masking a neurological disorder that required a different kind of treatment. The supplement not only didn't help, it delayed the correct diagnosis. These cases are not isolated. Doctors are increasingly reporting patients with symptoms caused by excess iron or vitamin B12 in the body. Iron, when accumulated, can cause a condition called hemochromatosis, which damages organs silently. Although excess B12 is less toxic, it can interfere with lab tests and even favor the growth of certain abnormal cells. Just because something is sold freely doesn't mean it's risk-free. And the body sends the bill, sooner or later. It's important to understand that the body doesn't have a disposal button for excess nutrients. Unlike water, which the body eliminates easily, iron and B12 accumulate. And even low-dose supplements, when taken without control, can cause overload. It's like refueling a car without knowing the tank level. Eventually, it's going to overflow. And when that happens inside your body, the fix can be long and painful. And all of this can get even worse when these supplements interact with other medications or pre-existing conditions. Next, we'll explore these invisible risks that go unnoticed by those who mix medications, vitamins, and treatments without guidance, and what that can silently cause. Not everyone knows this, but supplements like iron and vitamin B12 can interact with other medications and cause unwanted effects. A classic example is iron competing with antibiotics, reducing the effectiveness of the treatment. It can also interfere with the absorption of other minerals, such as calcium and zinc. Vitamin B12, when in excess, can alter blood tests, masking real deficiencies. What was supposed to help, in some cases, ends up confusing the clinical picture even more. For those who take continuous medications, such as drugs for high blood pressure, diabetes, or depression, these interactions can be even more dangerous. Iron, for example, can irritate the gastrointestinal tract, worsening cases of gastritis or reflux. And vitamin B12 can react with certain antibiotics or anticonvulsants, altering their action. And the worst part, most people don't even imagine that vitamins can have this kind of impact. After all, they seem harmless, right? But they're not. The human body is a complex mechanism where everything is delicately interconnected. Adding supplements without need is like throwing a random piece inside a Swiss watch. The damage might be invisible at first, but deep over time. That's why doctors and nutritionists stress so much the importance of personalization. What works for one person can be poison for another, literally. Each body reacts in a unique way, and that includes unexpected reactions to substances that seem natural. Moreover, many people take more than one supplement at the same time, without knowing they are stacking doses of iron and B12 in different products. Multivitamins, isolated capsules, energy shakes. When everything is added up, the excess settles in silently. The body may even try to compensate, but eventually, the signs appear: nausea, fatigue, skin changes, joint pain. Yet, again, few suspect that the villain might be sitting on their own health shelf. This is where the importance of informed decisions and professional monitoring comes in. In the next topic, we'll show the conscious path, how to find out if you really need supplements, which tests are essential, and how to do this safely without putting your health at risk, not in the short term, nor in the long term. The good news is that yes, there is a safe and smart way when it comes to supplementing iron and vitamin B12. And it all starts with a key word: personalization. The first step is to consult a health professional, such as a doctor or nutritionist, who can assess your symptoms, your history, and most importantly, order the right tests. This includes a complete blood count, ferritin, vitamin B12, and in some cases, folic acid and liver function. Only with this data in hand is it possible to know what your body truly needs. No more, no less. Another important step is understanding that a supplement is not a shortcut. It's a tool. It serves to correct a real and specific deficiency, not to boost your health by force. Diet remains the foundation of everything. Foods rich in iron, such as beans, lentils, and red meat, and natural sources of B12, like eggs and liver, are enough for most people. Supplementing without deficiency is like reinforcing a wall that's already firm, unnecessary, and sometimes dangerous. It's also essential to respect the timing of each phase of the process. Correcting a deficiency doesn't happen overnight, and increasing the dose on your own doesn't speed up the result. It just increases the risk. With proper monitoring, it's possible to adjust doses, monitor effects, and ensure the body is responding well. In addition, professionals can assess whether other factors are influencing the symptoms, preventing you from treating the wrong symptom for months. Another little discussed point: supplements should be reviewed periodically. What is necessary today may no longer be needed tomorrow. Many people continue taking iron or B12 for years, even after their levels have normalized, simply out of habit. This prolonged use, without reevaluation, is what most often leads to complications. That's why cycles of use, pauses, and new tests should be part of the routine for anyone who truly needs to supplement. It's not about using more, it's about using better. And sometimes, the wisest decision is not to take anything. Understanding that is not weakness, it's awareness. In the final point, we're going to tie everything we've seen so far and reinforce why information and balance are the greatest allies when it comes to health, especially in the world of supplements. We've reached the end of a warning that can literally change the way you take care of your health. Supplements like iron and vitamin B12 are important, yes, but they're not harmless as many believe. They must be used responsibly, based on lab tests, and with professional guidance. Throughout this video, you've seen how improper use can lead to delayed diagnoses and even serious health problems. And now, with this knowledge, you are more prepared than most to make conscious decisions. That's already a big step. Information is freedom. Knowing when to use, when to avoid, and when to seek help is what sets apart those who truly care for their health from those who merely react to symptoms. And more than ever, we live in a time when making informed decisions is an act of personal responsibility. If this content helped you in any way, imagine the impact it can have on others who are still trapped in the self-medication cycle. So if you haven't done so yet, like this video, share it, and subscribe to the channel. You help us reach even more people with quality information. And tell me here in the comments, have you ever fallen into the trap of taking iron or vitamin B12 without guidance? How was your experience? Your story can help other people avoid the same mistakes, or better understand what they're going through now. This space is ours, made for sharing, for reflection, and especially for building a more conscious approach to health. Let's keep this conversation going, because that's where the most real transformations begin. Finally, remember, taking care of the body goes far beyond swallowing pills. It requires listening, attention, and above all, patience. The solution is not always in the bottle. Often, it's in the choice to stop, think, and look for the right path. And if you've come this far, you've already taken that first step. Now just move forward with clarity, and whenever you need to, come back here to remember that your health deserves more than shortcuts.